COVID-19 pandemic, we had to make modifications to the routine service delivery modality that we used to have, which was a home-based face-to-face encounter between beneficiaries and service providers. So because COVID-19 risk of transmission to our beneficiaries was high, and HIV-infected children, adolescents, and their caregivers were at risk of infection and death, we wanted to reduce that risk by minimizing contact. We were informed that children were eligible to take their antiretroviral medication every 3 months, and if they were adolescents with HIV above the age of 14 years, they were eligible to take it every 6 months. So as a result, we decided to first inform them. So we developed a telephone-based counseling script. So we called every eligible caregiver or adolescent, and we informed them that there is a multi-month dispensing approach that the government has adopted. So we informed them that every child or adolescent with HIV can take the drug for 3 to 6 months. We reached around 80% of clients through the phone-based counseling, but around 20% of our clients did not have phone, so we had to arrange a home visit. During home visit, our service providers wore face masks. They applied the appropriate hand hygiene, and they still used the counseling script to assess their adherence and assess the medication on hand that they had. So based on that, they made sure that 3 to 6 months treatment was available for all our beneficiaries with HIV. So we worked in partnership with the healthcare workers at every health facility, and that's why the success was so remarkable. At 98% of children and adolescents with HIV having received the multi-month dispensing.
We have working with CVC project for the last 3 years. We have working on different intervention. Out of this intervention, multi-monthly dispensing is one activity. Because of this efforts, most children and adolescents living with HIV informed about the availability of multi-monthly dispensing schedule, and the enrolled offices informed this availability. In this COVID time, our beneficiaries that came from far area were not came at this, their appointment period. So we work with other stakeholders, especially that provide community ART distribution, and we reimburse their transportation, especially during transportation restriction, and for beneficiaries that came from far area, we reimburse this, and they came to the health facility to get their ART meds.
My responsibility is to make HIV risk assessments, to make HIV testing at health facility level and community level, to provide adherence counseling, and to monitor their viral status. My daily MMD target is 7, so I make phone counseling for 7 HIV positive OVC and caregivers. So through phone counseling, I use adherence checklist. So through this checklist, we make phone counseling. So like we ask different kind of question, like how many dose he or she missed.
ቤት ለቤት እየሄድን በየጊዜው ሳንሰለች ነው ቤት ለቤት ሄደን እምንጠይቃቸው። በዚህ ሂደት ውስጥ ያሉባቸውን ክፍተቶችና ማለት የሚቸግሯቸው ነገሮች ምንድናቸው የሚለው እናያለን። በዚህ መሐከል ላይ የገንዘብ ችግር ከሆነ የምግብ እጦት ከሆነ ሌሎችም ችግሮች ካሉ ከሚመለከታቸው አካላቶች ጋር እናገናኛቸዋለን። ይሄንን እንሰራለን እኛ። በደማቸው ውስጥ HIV ቫይረስ ያለባቸው ሰዎች ጋር አብረን የምናወራው ምንድነው ትልቁ ክፍተት መድኃኒት በአግባቡ አለመውሰድ፣ ማቆራረጥ ሊሆን ይችላል፣ ሰዓት አለመጠበቅ ሊሆን ይችላል። እንዲሁም የመድኃኒቱ አቀማመጥ ሁኔታ በራሱ መድኃኒቱ የሚበላሽባቸው ሁኔታዎች አሉ። በጣም ደብቀው የሚያስቀምጡ አሉ፣ ቤተሰብ እንዲያውቅባቸው የማይፈልጉ አሉ እና በዚህ ዙሪያ ላይ በደንብ እንወያያለን። መድኃኒት እንዳያቆራርጡ ያሉባቸው ደግሞ ለማቆራረጥ ምክንያት የሆኑባቸውን ነገሮች እንወያያለን። ተወያይተን የምክንያቶቻቸው ላይ መፍትሄ አስቀምጠን እንሄዳለን። ለምሳሌ ያው ስራ እስከተሰራ ድረስ ችግር ይኖራል። ይሄንን የምናደርገው ሰኞ ጧት 2 ሰዓት ተኩል ላይ ከአለቆቻችን ጋር ተገናኝተን ያሉብንን ሳምንቱን ሙሉ ያሉብንን ክፍተቶች እናያለን፣ መፍትሄዎችንም እናበጃለን። እኛ ደግሞ ሮብ ከ8 ሰዓት ጀምሮ ከቮለንተሮቻችን ጋር ሳምንታዊ የግንኙነት ጊዜ አለን። በዚህ መካከል ያሉብንን ጋፖች ለመሙላት እንሞክራለን። ከስራዬ በጣም የሚያስደስተኝ ተመርምረው ራሳቸውን ሳያውቁ ተደብቀው በጣም ተጎድተው የነበሩ ሰዎችን ቤት ለቤት ሄደን አስሰን አግኝተን ተመርምረው ውጤታቸውን አውቀው ከነ ልጆቻቸው መድኃኒት እንዲጀምሩ ማድረጋችን ይሄ ነገር በጣም ያስደስተኛል። ለእኔም ደግሞ ሰክሰስ ነው ብዬ አስባለሁ።
With all these efforts like phone counseling, home-to-home visitings, community stakeholder and strong collaboration with governmental sectors through our social service worker, case worker, we achieved more than 90% of our MMD targets.